Minister Jim Reiter and Chief Medical Health Officer Dr. Shahab. Joining us over the line, currently in Saskatoon, is Scott Livingstone, CEO of the Saskatchewan Health Authority. Both the Minister and the Doctor will have opening remarks, followed by time for questions.
Thank you for joining us here today. We have seen more than a week with relatively low case counts, with 4 new cases today. Many of these cases have been linked to interprovincial travel, and as the Premier addressed on Wednesday, we encourage everyone to limit their non-essential travel outside the province at this time. If you can, stay close to home. Keep washing your hands, wear a mask when required or when you cannot physically distance, and these measures have proven to be effective. Saskatchewan has seen a return to low active case numbers, but we know that this can change quickly. Testing and contact investigations are vital to helping us capture transmission in the province. We have 2 key announcements today. First, we're announcing the start dates and locations for drive-through testing sites in Regina and Saskatoon. In Regina, drive-through testing will be available starting Tuesday, September the 8th at the International Trade Center at Evers Place in Hall C. In Saskatoon, drive-through testing will begin on Thursday, September the 10th at 3630 Thatcher Avenue. Collectively, Regina and Saskatoon account for approximately half of our provincial testing each day, and drive-through testing sites are one of the ways the SHA is expanding the options for people to get tested for COVID-19. This format will certainly be more convenient for more residents, but please note that there will still be a patient registration process and specimen collection and cleaning protocols that need to be followed. It's first come, first serve, so there may be some wait times. SHA staff will be working hard to make the testing process as easy as possible, but they still must ensure accuracy and safety for all. You will need to bring a valid Saskatchewan health card and a mask for everyone in the car being tested. To respect patient privacy and safety, we ask that families only bring people within their immediate family or family bubble. Referrals for testing at our other testing and assessment centers can still be obtained by phoning Healthline 811 or through your family physician or nurse practitioner. And today we're also announcing the first 3 high schools to have voluntary testing available to students and staff on site. Campbell High School in Regina will have on-site testing on September the 16th. St. Mary's in Saskatoon will be on September the 17th, and PA Carleton and Prince Albert will be on September 17th and 18th as their classes are staggered. If your child attends one of these 3 schools, watch for consent forms coming home for signature by Wednesday, September the 9th. Further information on other voluntary school testing will be provided in the near future. This voluntary testing is being conducted as part of additional monitoring in school settings, but please do not wait for in-school testing if experiencing symptoms. Testing is available and teachers are a priority group for testing. Our testing strategy also includes the flexibility to conduct testing in school in the event of an outbreak. As we return to school, and as we move more and more activities indoors, all residents should be monitoring for symptoms. Together, we can limit the transmission of COVID-19 in our communities. I'd now ask Dr. Shahab for his opening comments.
Thank you, Minister. So this is the start of a long weekend with beautiful weather, so it's important for us to go out and enjoy this nice weather while we still have it, outdoors and at a safe distance, of course. And certainly as we are out and about, as we have been over the summer, it's important not to forget all the good things we've been doing while enjoying the beautiful outdoors. But then as we look to the future, to next week, there's a lot of excitement among staff and students about back to school. And for all of us with families, either in our household who are going back to school to either teach or work in school or as students, and because we may have extended family members who are going back to school, I think it's important once the long weekend is over for us to reset our bubble to keep everyone safe. I've had the pleasure of visiting a few schools, both high schools and elementary schools in the Regina area, and it's been really reassuring to see all the hard work staff have been putting in this past week, getting ready for school. And also as we enter the fall, we will be spending more and more time indoors, and then all the things we've been doing throughout the summer will be doubly important. Washing our hands frequently, maintaining physical distance, mask use where appropriate. We already see a lot of mask use in indoor public spaces, and that's something that all of us need to continue to practice. Have a mask on hand, and when you're in a public place and can't maintain the 2-meter distance, just put it on for that period of time. And I just want to again say that this is really a time for us to pause and congratulate ourselves. We've been through almost 6 months of the pandemic. It's been a slightly different time for all of us, but we've done so well. Our case numbers are so low, and this really is a time to pause and congratulate ourselves and move confidently forward into back to school, back to work as we enter the fall. Thank you very much.
Thank you, Doctor. Thank you, Minister. We'll take our first question from the phone line. Operator.
We have Zach Becerra with the Star Phoenix.
Hi there. This question is for Scott Livingston and also Dr. Shahab and Mr. Reiter if they care to weigh in. There was a goal set of having the capacity to do 4,000 COVID-19 tests per day around this time when kids and teachers are getting ready to go back to school. Have we met that target?
So thanks for the question, Zach. Zach, can you hear me? Am I off mute? I just want to check.
We can hear you.
I can hear you. You're good.
Okay. So thanks for the question. So as you know, we have been aggressively working to expand testing capacity across the province, and today's announcement with the first-year expansion of both school testing and the new drive-through testing in both Saskatoon and Regina is a part of that challenge. So the answer to that question is yes. If we had 3,000 or 4,000 swabs come in today, we would be able to meet that target. What we're trying to do now, and what we don't have, is we currently don't have capacity to meet 7 day a week at 4,000, but that is what we're actively working on. As you've probably already been told and heard, we've posted more than 50 positions across our lab services. We've had over 150 applicants. We're onboarding people every day. And as I said, our capacity throughout the pandemic has never really been challenged. We've met the demand every day that it's come in, and we will continue to do that as we move forward. We don't expect that we're going to need that capacity next week, but if we do have that type of volume coming in, we will actually process those things. And what we're trying to do, again, is to make sure that the lab not only serves COVID patients, but also non-COVID patients. So it's important for us to make sure that we can bring in both swabs as supplies and reagent to be able to do that, and we're confident that we can meet that demand as we further expand testing with this announcement today.
Go ahead.
Chief Medical Health Officer has a comment.
And thank you for that question. And I'll also like to add that if you look at our dashboard on testing numbers, they've been consistently going up. So our testing numbers are high and appropriate throughout the province. And I have to also mention that as our testing numbers expect to go up through testing in schools and drive-in testing, our test positivity rate remains extremely low, which is very reassuring. It's around 0.3%, so that's another important number to track. And our affected reproductive number also remains very low. It's around that 0.5 to 0.7 range. So I think all these things are really important as we go into the fall. The capacity to entertain testing numbers as they rise, but also looking at testing distribution throughout the province, which we have on our dashboard, and the test positivity rate. Thank you.
Follow-up, Zach?
Yes, this is a follow-up for Dr. Shahab. You mentioned that just now, as you did last week, that this is the time that families should really be looking at assessing their summer bubbles and who they have close contact with. Many people I've spoken to and many readers have reached out basically saying that they are feeling a lot of trepidation about that. They don't know how that's going to be possible to limit their bubble to 15 people. And I think people are really looking at for some advice on how to do that effectively. How should people approach that problem, Dr. Shahab, of making sure we're not having close contact with too many people?
Yeah, I think that's a really excellent question, and we all have to look at our own situation. How big is our household? How many close contacts do all of our household members have? And we went into lockdown March, April, May, then we emerged from lockdown. We enjoyed the summer with friends and family, expanded our virtual households up to 3 to 5 households, 15 families, could have indoor or outdoor gatherings of up to 30 people. And I have to say, I can't say this enough, I think we need to collectively pat ourselves on the back that we've done extremely well. We haven't, for the most part, seen large outbreaks in our family gatherings, outdoors or indoors, and so far we've done really well. But this is a time to reset, because as we move forward, just like when our essential workers, in healthcare, in retail went back to work, they had to adjust, because if you're working and then coming home, and if you have people within your virtual household who may be at higher risk, it's just being a bit aware of that, and just recognizing that some people may be at higher risk and may need some care when you're around them. So I think that's what we need to do, again, as we look at going back to work and going back to school, that especially as children and staff going back to school, just being aware that, if we have in our virtual bubble persons who may be at high risk, just being aware of that, obviously not going to school or work and not visiting people in a virtual bubble if we feel unwell, getting tested, staying home while you're sick. All those things are going to be important. But at the end of the day, I think we just need to keep our numbers small and consistent in terms of our close friends and family, and adjust it according to our own situation and our own health risks and health risks of the people we care about.
And we'll take our next question from the room. Callie?
So the dates for in-school testing, I guess what was kind of like the method for picking those dates? Because of course, they're not, the 2 weeks away. Do you want under 2 weeks? What was that method like?
Sure, I can start, or do you want to? I'll ask Dr. Shahab to add to this. I think a while ago already it was indicated that the intent was to have it in early September, so that's why next week. The SHA obviously had to arrange for capacity to do it, the mobile testing site. So if there was more criteria, more details, I'll see if Dr. Shahab would like to add to that.
Yeah, thanks. So like Mr. Scott Livingston mentioned, the testing capacity is there, and our testing rates currently are good. But as we go into the restart school, I think there's several things that we need to be aware of. First of all, the most important thing we can do is that if we are in a household with a child going to school, or a household member working or teaching in a school, if any of us has any symptoms, we should get tested and stay home, and that'll keep us safe, that'll keep our community safe and school safe. The second thing we need to recognize is that we're starting school at a time when we have very low community transmission, and that's something we need to be very reassured about. But if there were situations where there was high community transmission or a case or cluster in a school, the same mobile teams that are doing testing in the 3 schools, 2 weeks from now, will be able to go in a similar way to any school in Saskatchewan and support not just case contact tracing, but testing as required. So that's an additional capacity that I think is really important, and I think we need to recognize the Saskatchewan Health Authority for having that. And then finally, the 3 large high schools in urban areas were selected because our community transmission rates are very low. It's a bit of a assurance testing that we expect to see very few, if any, positive cases, but it's just an added layer of assurance. But I think it enables us to then have this capacity to go into a school setting when there's an outbreak and have testing with parental consent, and for remote isolated communities, have testing at a community that also supports testing in school. So I think this is just something which is an additional layer of capacity that will be there as needed.
Follow-up, Kelly?
Yeah, and when it comes to drive-through testing, how long do you think this will be maintainable for? Just because we have fall's very unpredictable, it sometimes gets cold pretty fast. It's going to be hard on the staff before it's hard on the people coming. How long do you think we have that window for?
We're not so concerned about, I get your question about, as winter comes, but the facilities we're using, I think we're going to be able to continue to operate it in the winter. We'll monitor it. It's starting several days a week. We'll see how much it is used, see if there's need to expand that capacity or scale it back as needed. But we anticipate that we can continue to run it for some time.
We'll take our next question on the phone line.
We have Lisa Schick with CJME.
Hi, this kind of relates to the last question there. The drive-through testing hours are pretty short, just about 8 hours during the week and then all day Saturday. Why did you choose, I guess, such a few number of hours?
I'll ask Scott if he wants to add to this in a minute, but I would just start with saying, the drive-through testing, there's been other jurisdictions that have used this with some success. We haven't used it here yet, so we thought it was important to start somewhere, monitor it, see how it works. That's why, I cautioned in my opening comments that we ask people to be patient if there are wait times. We want to see how it works, and we can adjust accordingly. Scott, did you want to add anything to that?
Just a little bit. The expansion of the drive-through testing is just another option that we're looking at to try to get people access to testing, and removing whatever barriers we can. So as the minister's already mentioned, and Dr. Shahab, the drive-through testing doesn't require referral. One of the advantages is we could have a whole family test at the same time because they can drive up in the car. And we were very conscious of making sure that we would actually create and build sites that are temporarily, but when I say temporarily, we have them put in place we believe they'll be up for 18 months. If they need to be shorter, we'll take them down, but we don't know at this time how popular they're going to be. So until we know how popular they're going to be and how many days a week and what type of hours that we should be running, we're going to start slow and see how the public is accepting of this type of testing. And then we'll look at how we expand that. And we fully have intention of expanding it if it's a welcome addition to this. But as you know, we've had ongoing challenges with getting people coming out for our testing. It's been opened up to the entire province through referral, but anybody in this province has been able to get a COVID test with symptoms or without since July 14th. And we're continuing to try to remove any barriers there are to people coming out and getting testing, as well as adding, as Dr. Shahab has outlined, and the minister, around mobile testing in schools for surveillance purposes.
Do you have a follow-up, Lisa?
Yeah, just about the lab there. I know, especially a little while ago when they were having, close to 2,000 tests a day, there was a lot of overtime being logged by the people in the lab. Do we know how much so far has been spent on overtime and kind of making sure that there's enough people in the lab to do the work?
I'll just make a comment, and then I'll ask Scott to comment on that. I'm not sure if he'd have numbers available yet or not, but the issue, Lisa, is, we've touched on earlier, is as we increase capacity there, at times it's going to need, and it has been in the past, we've needed to log some overtime when we have surges and testing needed. Scott mentioned earlier about we have a number of jobs advertised, so we're going to continue to increase capacity at the labs. But as far as actual dollars of overtime, Scott, I don't know if you'd have that number available, do you?
I don't, but we can certainly follow up and try to get that to Lisa.
We'll take our next question on the phone line.
We have Roberta Bell with Global.
My question is regarding test results that are being posted online and shared through your eHealth, your eHealth profile online. Apparently they're encouraging everyone to sign up and try to get their results that way, but I understand that there's quite a significant wait time with your new strategy of having people call for their PIN number. Some people are waiting over an hour to get that. Could you explain how this system's supposed to work and what steps you're going to take to make it smoother for people?
Sure. Obviously, if we have surges in numbers of people applying, there'd be a bit of delay. I'm not aware of what the most recent times are, Roberta, but I'll certainly be following up with eHealth on that. We ask people to be patient as we move forward with this. At times there are wait times for different services. We're kind of in uncharted territory these last few months with COVID, but we're going to endeavor to make that wait time as short as we possibly can.
Follow-up, Roberta?
So is there an option that maybe instead of having people call to get the PIN for their eHealth, my Sask eHealth record to get that service, to get test results online, that maybe there'll be another option where people can get their PIN a different way?
We'll certainly ask eHealth to look at all options, including that.
And we'll take our next question from the phone line.
We have David McIver with the Rosetown Eagle.
Yeah, my question is for Mr. Reiter. Jim, I'm not sure if anyone has addressed this before, but to move into Phase 5, where would the province have to be in terms of ballpark numbers for like new cases and active cases?
Thanks, Dave. And it's great to field a question from Rosetown. I'll eventually get home sometime tonight. Dave, I think it's fair to say we just haven't had a lot of discussion around that. There's been sort of ebbs and flows in the number of COVID cases, not just in Saskatchewan, but around the country. You saw not very long ago that Manitoba had a number of days of 0, very low numbers, and now their numbers have increased dramatically. So I think it's fair to say that at this stage of the game, there just hasn't been much discussion around that. We're not, I think it's fair to say, Dr. Shahab might want to add to this, but we're not kind of at a point where we're ready to say at this trigger we'd be doing that. We just think it's too early. That's okay.
Jim and everyone?
Do you have a follow-up, David?
No, that's all. Thank you.
Great. Kelly, do you have another question in the room?
Yeah, just, when it comes to the drive-through testing sites, of course, the 2 major cities, you did say that's because that's where you're seeing most people getting tested. I guess, will there be opportunities for testing in, more testing in rural areas, maybe in northern Saskatchewan, or what are your thoughts?
I think Scott may also want to add, but I think the volumes and there's, I think, 40 plus testing locations throughout the province, so access is good throughout the province, and the volumes are such that you don't need a drive-through option for the most part, but in Regina and Saskatoon, which are larger urban centers, you can have several options now, include drive-through where you don't need an appointment, but for others you can still call 811 or get a referral from your provider. So there's multiple pathways for testing, and beyond that, whenever we have a need for enhanced testing, mobile teams have been going out throughout Saskatchewan, southwest, central Saskatchewan, northwest. That's been a very successful additional support when testing ramp up is required. And so I don't know if Scott, you had anything further to add?
Yeah, just a little bit. So we continue to have multiple assessment and testing centers across the province, including all over rural Saskatchewan. And though we're examining what the acceptance and long-term sort of targets look like for the drive-through testing in Saskatoon and Regina, if in fact, it's something that looks like it's quite successful, we would look at pop-up testing sites similar in more rural locations. But right now, we do have lots of capacity in rural Saskatchewan for COVID testing, and we've never come close to that capacity to date. So we will expand as we need to, and as the public and school divisions with mobile testing and other alternatives come to us with respect to offering more testing across the province.
Follow-up, Kelly?
And when it comes to the in-school testing, of course, it's, at one school in each city, will there be transportation options put in place to get the kids with the consent form to the in-school, or will parents be responsible to transport the kids? How's that going to look like?
Yeah, so at the moment, the in-school testing is going to be in 3 high schools, and so consent forms will be going next week. And then the week after that, on the specific dates, students in high school will be offered testing in school. And public health always works closely with schools for public health services that include immunization, for example. So there's already a good way of supporting testing in that way. And then, depending on the setting, if there was a rural school or a school in a remote, isolated community where it was younger children needed to get tested because there was an increase in community transmission or a case or cluster and outbreak, and there the modality may be a bit different. It may be at a school or near a school, like you described, after school, where the testing could be opened up, especially for remote or rural communities. This testing could be opened up not just for younger students in school with their parents, but anyone else in the community who may need to get tested. So there's a variety of options and modalities, and again, it'll depend on the setting and the need for that testing.
So I guess, are you thinking that with Campbell Collegiate, are you thinking it's mostly going to be high school students? Or?
Yeah, yes, these 3 testing sites are high school students, and the testing will be in school during school hours by public health. And again, public health has been working throughout closely with schools and school divisions as part of reopening in the past, public health always works closely with schools for immunizations, for all kinds of funny rash illnesses that show up in schools. So that relationship had always been there between public health and schools, and that's the relationship that will support schools as they reopen.
And we'll take our last question from the phone line.
We have Jeff D'Andrea with PA Now.
Hi, thanks for taking my question. It says in the release, and you've made it clear in the opening statements here today, that students who are experiencing symptoms of COVID-19 to not wait for the in-school testing and just go through 811 like usual. But even still, are you worried about people with symptoms ignoring that advice and going to school to get a test anyway, knowing they can do it there now on the dates provided and not just through 811 anymore?
Yeah, thanks. And I think that's a really important point that Minister Reiter made, that, this year, so the testing is on specific dates, 2 weeks from now, but this is the year we should not go to work if we're unwell, and we should not have students going to school if they're unwell. We should stay home till we or our children are better, and if we have any concerns, we should get tested while we're at home. And for most people, that's by calling 811. And I think that's going to be important throughout the next weeks and months. But having said that, for children who are well and at school and staff who are well and at school, if there's a need to offer testing in schools, and right now it's being offered in 3 schools, but if there's an increase in community transmission, if there's been a case or cluster at a school, obviously close contacts of a case or cluster will be at home. They'll get tested through 811. But if there's a need to test, additional staff or students in school who are otherwise well, then access will be improved by offering additional testing in the school during school hours, or for young children after school hours for children and their families. So that's the approach. But I think it's a really important point that just because testing is happening at school doesn't mean that children who are unwell should come to school to get tested. They need to stay home and get tested through the 811 pathway or through their healthcare providers.
Do you have a follow-up, Jeff?
Yeah, and I know you touched on it a little bit, but the contingency plans, if that does happen, a person or a student with symptoms comes in anyways and is found to be positive, I mean, kind of what's the, the contingency plan after that?
So a couple of things there. One is that, obviously teachers know their students really well, and it's not just during COVID, but even before, if a child becomes unwell at school, teachers support the child, the school supports the child until parents can pick the child up. So the same principle will apply if a child has any symptoms. That could be COVID, it could be just another respiratory illness or a norovirus that goes around in winter, then the child will, stay in school till the parents can pick the child up. And obviously, every morning we should check with our children how they're feeling, and if a child is unwell, they shouldn't go to school, and that's why we need to have a backup plan about if a child is too young to stay home alone, what's the plan there to make that quick decision in the morning. But I think that's going to be really important going forward. And of course, regarding the other part of the question, if you have been tested positive as a case, you and your close household contacts or other contacts have to stay home for 14 days, and that's really important as well. Obviously, you can't go to school or work till those 14 days are over. And again, I think we need to congratulate ourselves. We've heard reports from other parts of the world where people have not complied with that, but I think in Saskatchewan people have been very diligent with complying with that direction and staying home as a case and contact, and that showed itself in the results we see. We haven't really seen an increase in transmission and now that it's end of summer, and I think we need to keep practicing those good things.
And Jeff, we can direct you to the parent information packages that were released last week that have that detailed information on protocols when a student or if a student tests positive. And that concludes our time for today. Thank you very much for joining us, everyone.